These two patients brushed their teeth in practically the same way. Neither one had perfect hygiene. Both of them accumulated plaque. Both of them had tartar. And yet, one of them lost almost all of his teeth, while the other kept practically all of his teeth. How is this possible? Especially since we're always told that teeth are lost from not brushing. The answer is that periodontal disease doesn't just depend on bacteria. It also depends on how your body responds to those bacteria. Think about this. Bacteria are like the spark, but inflammation is the fire. Some people can accumulate a lot of plaque for years and only develop mild inflammation. On the other hand, others with similar amounts of plaque develop a much more aggressive inflammatory response. This inflammation in their body starts to silently destroy the bone that supports the teeth. And when the bone disappears, the teeth start to loosen and are eventually lost. That's why we often remove teeth that are healthy and without cavities. Why? Because the bone supporting them was lost. Now, the most interesting part is that today we know factors like diabetes, obesity, smoking, certain immune system changes, genetics, or even some inflammatory diseases can greatly increase this risk. That's why two people with similar hygiene can have completely different results. Because it's not just about what's in the mouth, it's also about what's happening in the rest of the body. In fact, often when I see a patient losing teeth, the most important question isn't, are you brushing? The most important one is why your body's reacting this way. Because tooth loss isn't always a brushing problem. Sometimes it's a sign that there's something deeper going on with your health. And that's why we as dentists have to look beyond your mouth. Follow me and I'll give you much more information like this.